Good afternoon. I am Brittany Dunnigan Brittany Dunnigan Willis from Everdrive, Illinois. We want to welcome everyone and thank you for attending the Cultural Competency and Vaccines Lunch and Learn. We appreciate you taking out the time out of your busy schedule to understand how you can address cultural competency in the workplace. I want to go over a few housekeeping rules in regards to today's agenda. Each panelist will have 5 minutes. After each panelist, we will provide 2 minutes of questions, and then at the end there will be a discussion if there are any more questions that need to be addressed. Feel free to submit your questions or comments in the comment box as we're going along, and we will address those as well. Last but not least, we would like to thank the sponsors for this event: American Lung Association in Illinois, Illinois Academy of Family Physicians, Everthrive, Illinois, American Academy of Pediatrics, Illinois chapter, and Pfizer. We will now begin with Dr. Hussain.
Thank you. So I'm Aisha Hussain. I'm a family physician, and I'm the Chief Medical Officer at Asian Human Services Family Health Center. We are a federally qualified health center. We're located in the north part of Chicago in 2 suburbs, Skokie and Niles. Today I've been asked to present on Muslims and immunization. Our clinic sees a largely underinsured, uninsured immigrant population. Our mission statement at the clinic is to provide culturally competent and linguistically appropriate healthcare to patients. Now, having said that, most of the patients that I see in my personal panel, they are from South Asia and Southeast Asia, and a large part of that population is of the Muslim faith. I wanted to throw in a little bit about Islam and Muslims because in talking to my colleagues, I found that, surprisingly, there is a lack of knowledge about some of the very basic concepts in Islam and a little bit about the attitude Islam had towards prevention. So I wanted to throw in a few slides to say people that follow Islam are called Muslims. There's about 1.8 billion followers, which is 24% of the world's population. It is the 2nd largest religion in the world. Here in America, 1% of the U.S. population is Muslim, but something to notice, by the year 2050, it will become the 2nd largest faith group in the country. Some basic concepts. So the holy book is known as the Quran, and that is what a lot of Muslims follow, akin to like the Bible in Christianity. One of the basic concepts in Islam features around what is halal or permitted for the religion and what is haram or what is forbidden. So like alcohol and pork are haram. And in terms of immunizations, this sometimes comes up with patients asking you about what the vaccines are made up of, and is that halal or is that haram? One of the lesser known concepts, I feel, in Islam is this law of necessity, which says basically that the person is not guilty of sin in a situation where the lack of a halal alternative creates an undesired necessity to consume that which is otherwise haram. So there is room in there for that. The Quran has 28 verses that focus on diet, nutrition, personal hygiene, alcohol abstinence, and the importance of a healthy lifestyle. It also endorses this concept of prevention. And so immunizations are a form of prevention, and sometimes I will use that to talk to my patients. You may see Muslim patients coming in to see you during the month of Ramadan. So it's a month of the Islamic calendar where Muslim patients will fast from sunrise to sunset. Even though there is nothing in Islam that says you cannot get a vaccine because it's really not providing any form of sustenance, and that is forbidden during the month of Ramadan when you're fasting. Practically, there's a lot of resistance to getting any kinds of immunizations. That's what I found practically at my clinic. Is like patients will say, no, I'm fasting, and you try to reason with them. And then there's a study that I found in the journal Vaccine in 2017 that said only 40% of Muslims agreed to blood sampling, even though religious leaders were favoring patients getting vaccines in blood draws during that month of Ramadan. So that's kind of a challenging conversation to have. Another time where you may meet a lot of adult Muslim patients coming in to see you for immunization would be before they embark on the Hajj, which is a holy pilgrimage. And then it's the Kingdom of Saudi Arabia, which is where the Hajj is held every year, that decides what are the criteria that people need to fulfill in terms of the forms and the vaccinations for that year. The meningococcal vaccine is mandatory. They do not issue visas for the Hajj or the Umrah without the meningococcal vaccine. So that's something that they need. And if you look up the CDC, they recommend that anyone traveling from the USA to Saudi Arabia, they be up to date on all of the routine immunizations. They also recommend typhoid vaccine and hepatitis A vaccine to be given because amongst the local communities there you will find these two diseases. Not prevalent, but they could be found. So coming back to my experience at Asian Human Services Family Health Center, seeing a large number of Muslim patients, I mean, I found that the attitudes are less based off of their religion and more based off of the countries that they come from and the cultures that they bring with them. Sometimes I've had patients ask me about the contents of the vaccine being halal or not. I found most patients will refuse immunizations during the month of Ramadan. I have not filled out in my 10 years at Asian Human Services Family Health Center a religious exemption for a Muslim patient. So we have that form that the state of Illinois uses, and I have never filled one out. And in talking to my colleagues, they have never filled out a form for a Muslim patient coming in and kind of like refusing a vaccine. Amongst our pediatric patients, we do see a big resistance amongst the Somalian Muslims or just even Somalian patients in general with the MMR. And I think that's more, it's not a religious argument. It's more the fear of autism and some other social factors. We have problems with the HPV vaccine because of the whole sexual conversation that comes into play, and and the flu vaccine, mostly because these patients, I mean, these people, even though they're Muslim, they're coming in from underdeveloped countries, and the concepts of immunizations and primary care is lacking. So again, I don't see it coming from like a religious point of view. When we've had resistance amongst the Muslim population, it has been more like, my shot record was complete from back home, like India or Pakistan. Why do I need 6 other shots? And why is my child getting 6 shots? So again, not to do with religion, but more to do with the concept of prevention not being something that these patients are kind of used to. And so even though Islam promotes preventative care, it is an alien concept in the developing countries from where these Muslim patients are coming from. So those are my experiences. If anyone has any questions, I would be happy to answer.
That's a good question. You get questions about the content of the vaccines themselves?
I do.
So, well-being or whatever.
Right, and so I do. And then a lot of times, I'll use that law of necessity to talk to them, to be like, in Islam, that, it promotes prevention, and if there is a halal alternative, then maybe we could look into it. But this is what we have right now, and even if the contents were not purely halal, this is for your good, and you're exempted by that. Because I didn't want to get into like every manufacturer has different preservatives and stuff, and honestly, it's not a question that comes a lot, but sometimes, and the concern is more with pork. That's the questions that I've had. Like, are there any pork products? I've never had any questions about any other constituents other than pork, and that's easy enough to look up. We could always look it up to see if there are any pork derivatives in it.
In terms of dealing with the families, is there a certain decision maker in the family? Like, how would you approach that? Or
I mean, I feel like every culture is different, and there are certain cultures in which, yes, the men will come in and ask all of the questions versus the women. But a lot of times when they see that the provider is female and speaks the language, then, the moms come in and then they start to speak with us. Like at our site at Peterson, we have about 12 or 14 languages that we speak on site, and so we're able to, kind of convince them to ask their questions. And it varies, that's the answer.
Any questions online? Did we receive any questions? No? Okay. Okay. Thank you, Dr. Hassan. So next we will move to Dr. Mora.
So good afternoon, everyone. Thank you for being here. Thank you to American Lung Association, the IAFP, AAP as well too, and EverThrive for having us today in discussing culture of competency and vaccinations in the Latino community. I am MedPeds trained and then did allergy and immunology fellowship, and now I probably get to put my PEDS hat back on today, which is a real pleasure for me. And I practiced in my own practice, Chicago Allergy Center, for the last 3 years as an allergist, and I deal a lot with the Latino community, so it's a pleasure to be talking about them today. So, talking about Latinos in the United States, they are the largest growing population within the U.S. There's about 35 million Latinos that currently reside in the U.S., and they comprise about 16% of the U.S. population. And this proportion is anticipated to increase to 30% by the year 2050. The three largest subgroups include Mexican Americans, about 65%, Puerto Ricans, about 9.1%, and Cuban Americans, about 3.5%. So let's talk about immunization rates in Latinos. Immunization rates are lower in Latinos for the most commonly recommended vaccine than in any other ethnic group in the United States. The childhood immunization rates for Latino children living in the U.S. is 79% via the Federal Interagency Bureau on Child and Family Statistics in 2005. When we look at the actual native countries, Mexico, Nicaragua, Peru, vaccination rates there are 95%. So what happens when these Latinos come into the United States, and what are the barriers that they encounter? One big one is the language barrier. Medical terminology can itself be very complicated. So facilitating it in the language that they speak is going to be very, very important. Two, the lack of healthcare providers who speak Spanish, doctors, nurses, medical assistants, office staff, who are able to explain the importance of vaccinations in Spanish. There's a lack of trained Spanish interpreters often at hospital sites, clinics as well too. Lack of vaccine literature in Spanish as well too, so that we can give them and explain to them what these children are getting and why they're so necessary. And when they've looked at studies, Latinos generally report feeling less listened to and understood by their doctors, and they are twice as likely to leave the doctor's office with unasked questions. There's also the access to healthcare, the socioeconomic disparities. Latinos are far more likely than overall population in the U.S. to live in poverty. About 23% of Latinos actually live in poverty in the United States. And nearly 33%, 1/3 of all Latinos in the U.S. lack health insurance. So even among insured Latinos, coverage and care are far from adequate. Most receive care in the emergency department or urgent care. They don't go to their primary care physician where they're going to learn about vaccinations, get the anticipatory guidance, and where really vaccinations are given. There's also concern about the cost of medication. Their lack of knowledge of free government programs to help children get vaccinations free of charge. There's lack of community outreach as well to the Latino community, and there's lack of more health fairs to reach the Latino community as well too. Now, one big thing that we're seeing more, especially in those Latinos that are coming from Mexico and other countries as well too, is they fear getting vaccinations a lot of the time because of their citizenship status. There's a fear of seeking medical care and applying for medical insurance because they fear deportation and family separation. They also, and studies have shown us that recent arrivals to the United States are more likely to be isolated from mainstream U.S. society and to be unfamiliar with the U.S. healthcare system and they're afraid to integrate really because of the fear of deportation. Then there's a lack of media outreach to the Latino community. There's lack of media resources to target Latino children and parents on importance of vaccinations on Spanish-speaking TV stations, which we can target through Univision, Telemundo, which definitely can be done. There's lack of community outreach as well too. And then in the actual Latino community, we need to encompass all caretakers in the family on the education of the importance of vaccination. So Latinos have family-centered decision-making model, so la familia. So not the dad alone makes the decisions, not the mom alone. So it's the abuelitos, the grandparents get involved, the aunts and uncles, everyone has a voice in the Latino family. So that's something we need to integrate as well too. And then there's cultural mistrust. Seeking healthcare alternatives in the Latino community. So they will not want to go to a Western medicine doctor, but they'll instead look for folk medicine and traditional healers, curanderos, or herbal remedies. They don't need the flu vaccine. They just need some herbs and, you know, they will get better. This is a belief that they have. So it's kind of breaking down these beliefs. So let's bridge the gap. Si se puede.
Thank you, Dr. Mora. Are there any questions in the room?
To get vaccinated, then you don't ask our citizens or anything like that. They come, you serve them, that's it.
That's exactly right. But then in a lot of the federal agencies where they actually have to give their name, their address and everything else too, they fear that their information is going to be given to the government and further on. And yeah. Well, some of it has to be reported, especially if the child is getting a vaccine. It's through, yes, absolutely.
So that would give you a state more business as a
private practice, absolutely.
So what recommendations have you implemented or thought about to encourage that open dialogue or to reach out to the community?
So one thing is going out into the community and talking. I honestly love going into schools and talking to parent groups as well too, doing health fairs within the community as well too. Pilsen, La Villita, all the main Hispanic actual cultural neighborhoods, just because the more they hear, and because I'm Hispanic, they do tend to trust me a little bit more. Well, Doctora Mora says this, so it must be true. Not that I'm always right, but it gives them this trust. They can have this dialogue. They can come up to me even after I do a talk or anything else, and they can say, I had one more question for you, and where, you know, what do you think about this, and et cetera. So it's opening that dialogue. And I've done Univision as well too, a little bit of Telemundo as well too, because I think media outreach is so big. Everyone in that Hispanic television has a television at home and they watch the 10 o'clock news on Univision or Telemundo. So if you reach them through that, you really do get it.
Okay.
Yeah.
Thank you.
As a clinician, can you talk about like the decision-making process? You mentioned it a little bit, but as a clinician, do you like offer that to the family and then kind of let the family talk and then come back in the room and hear the decision, or how does that go?
Oh, excellent question. So if it's a strong mom and she's coming with the kids or anything else, and you know, I see a confidence in her, I always tell her all the information and say, you know, you can think about it and then, you know, discuss it with your husband, etc., and then come back to me. Or she might just say at that point, you know what, I trust you, Dr. Moore, let's go ahead and do that. But in starting that dialogue, you definitely want to make sure that you give them all the information that you can, and then they can bring it home, so that way the husband doesn't feel excluded that, well, my children got vaccinated without even talking to me. She just made that decision versus having a complete open dialogue. And then I get everyone in for the flu shot, including the dad.
And then there was one question from the audience about the lack of Spanish translated materials and how that affects immunization rates.
Oh, I definitely think that's one big factor, because we don't have enough Spanish-speaking staff to go around. So if we have materials that can be given in clinics where Spanish might not be spoken, then I think that helps to bridge the gap. So that would be very, very helpful.
Okay. Thank you, Dr. Mora.
You're welcome.
So next we will move to Dr. Russell. I mean, Dr. Pierce. I'm so sorry.
Good afternoon. My name is Maria Lisa Pierce, and I'm a general pediatrician here in Chicago. My background beginning in pediatrics, my very first position I had for about 24 months was in a community in rural Illinois. Born in Chicago, kind of a big city kid. That helped me understand that everybody doesn't practice medicine and everybody doesn't have the same beliefs in rural America. Then I moved from there to become an academic physician, and I worked for 7 years in a federally qualified health center. So about 95% of my patients were Medicaid. And then after that, I've now moved and I have a private practice. And I just have a big cross-section of families. I have medically underserved. I have people from other countries. I have a very big mix of ethnicities. And I'd like to talk about cultural competence using the point of view as physicians being curious learners and how much you can learn from your family. So the first thing that I like for people to remember, for clinicians and other healthcare professionals, is to try to be aware of your own cultural beliefs and what are your values. In order for you to talk to people from various ethnicities and socioeconomic groups, you need to kind of understand and be aware of where you're coming from. And when you talk to families, you need to impart a curious, kind demeanor so that they feel comfortable asking you any question in the world, so they won't feel like you're going to look down on me if I ask you, you know, if this vaccine got weird components in it. You want to really make sure that they know, and you can speak openly that, you know, your culture is different than my culture. And so you want to make people feel comfortable teaching you about their culture, because none of us in the room is going to know every single culture. Whatever culture we were born in, there's so many variations within our own culture. And so if you can keep an open dialogue, I like to say you're going to learn something from your families every day. So you want to understand the dynamics of difference. You want to make sure that in your practice setting that people feel comfortable that you're working on a team. You want to make sure that you're setting a tone that you're not an authoritative person and it's your way or the highway. You want to set a tone. You want to make sure your office staff are encouraging people to ask questions, validating, well, that's a really good question. Make sure you write it down so that Dr. Pierce can answer that for you. So you really, really want to make people not feel odd because they may feel that they're different. You want to assess your own cultural knowledge, and no matter how much you think you know, there's so much more to learn. So just take your time, and if there's something that you don't know, just ask them, well, can you teach me? You know, how can I learn? And people love to teach their doctors. You want to make sure that you and your staff are showing an ability to adapt to diversity. You want to make sure if a family comes in and there are 2 dads or there are 2 moms, that they feel welcome in your practice. You want to make sure that everybody is able to give you feedback. I had one family with 2 moms that told me that my registration form was not correct because it said who's the mother, who's the father. She said you could just quite simply say parents and parents. Okay, because she was letting me know that by looking at that, that made her feel uncomfortable. So we had to make a modification because we don't want anybody uncomfortable. So for the entire staff, wherever you work, however you large your staff is, does your staff show empathy? If somebody comes in and they're very, very worried about the prospect of vaccines or some other kind of, you know, unusual medical problem, does your staff encourage people to talk about what they're worried about? Are there diverse models? If you have educational posters in your office, are there diverse models? Do people see people on the posters that look like them? That's a welcoming feel, that's a comforting feel if you see someone to look like you. When we go to different vaccine meetings, there's always literature in at least more than one language, and I bring the literature in, usually it's going to be Spanish, And I keep it because I'm going to run into families that I might not be able to explain well in English, but I have the handout in English, and then I can give it in Spanish so we can go over that together. Another thing that I find very, very large in pediatrics is the family questioning and feeling you out to see, are you okay if I'm considering complementary medicine? Are you okay if I'm thinking about alternative medicine? And if you've made them feel comfortable in discussing things, they'll tell you what they're thinking of. Some of the things that they may bring up, I have heard of and I know about, but if there are things that they don't know, I have families bring me brochures, I have families send me links. I have a wonderful health food store just across the street from my office that I can go and I can research and find out, more about what they're teaching me. In many respects, if a family knows that you've heard of what they're talking about and you're okay with it, there really is a way to blend that alternative or complementary medicine right along with what you're doing. So again, we want to make sure that people feel comfortable talking. The last thing that I wanted to talk about for vaccines was to talk about parents wanting to know what components are in vaccines. I do have a predominantly African American population in my practice, and there is mistrust issues about vaccines, and especially influenza vaccines. For some people that really have to know an answer, I point them to a book called The Pink Book. It's an immunization book. It tells the history of vaccines. It tells components. I tell them which appendix they can look it up. I've even had families ask me to go to the refrigerator and take out a product insert and bring it and share it with me. And as long as you make them feel comfortable, yes, I share all the information with them. So any questions for me?
One question. So you said that you do have, I guess, what are some other common questions that you get from parents?
I have parents that want to know about components in vaccines. I have parents that have concerns, just as Dr. Hussein said, about the number of shots. And then I have parents that are having influence from other family members, grandparents, aunts, uncles, about the entire process of vaccines. Why are there so many? There weren't so many 20 or 30 years ago. So very similar to what they're saying.
And then do you see a shift when it comes to those that are hesitant, or even those that are anti-vaccine, or?
So every vaccine delayer or refuser is not the same. I meet some families that have been excluded from other practices because they didn't feel comfortable with vaccines. A lot of it boils down to trust. Someone didn't take the time to explain to them why the schedule is the way it is, why we want the vaccines done at a certain age, what the components are, what the illnesses are. I like to have pictures or videos so they know what the illnesses are, because some families are more afraid of the vaccine than they are the illness. There are some people, no matter how much you educate, still feel uncomfortable, but I try to make sure that we have a very respectful dialogue and that they still come for their regular well child visits. I bring them up every single time. You'd be surprised when you least expect it, they accept it. It might be delayed, but they're still accepting it. So yeah, it's interesting. It's never dull.
Thank you. Okay, so we will move on to our last speaker, Dr. Russell.
Thank you. So thank you everyone for being here. My name is Margaret Russell. I'm a second-year family medicine resident at the McGaugh Northwestern Family Medicine Program in Humboldt Park at Erie Family Health Center. I'm also their HIV area of concentration resident, which means I also do a lot of the LGBTQ care that goes on at our center, and it's also an area of interest of mine even before starting residency, is closing sort of the gap in the healthcare disparities among the LGBTQ population. So that's what I'll be talking about today. So first of all, just to sort of start off, to talk about what are we talking about when we talk about LGBTQ, because it's a huge and diverse community of people. And I like to use, I think this graphic is really great, the gender unicorn. So we're talking about gender identity, whether someone feels that they are male or female or some combination or some other gender entirely. We're talking about their gender presentation and expression, which is how they appear on the outside, how they dress, how they do their hair, makeup, jewelry, all those sorts of things. How they speak, how they interact in the world, their mannerisms, all of those things fall under expression, presentation. Their sex assigned at birth, of course, which could be female, male, or intersex, which has more to do with biology and genetics. Who you're sexually attracted to, men, women, both, some other gender, and who they're romantically or emotionally attracted to, because it might not always be the same things. And so when we talk about the LGBT community, it encompasses all of these different things and how they interact. So it's very difficult to say, while there are many cultural aspects and many shared experiences and shared challenges within the LGBT community, it's a very diverse community. They don't all have the same needs and the same experiences. The next thing to sort of think about is, and this is a product, not an exhaustive list, but a product of a very brief Google search of organizations for LGBTQ people within other cultural identities, other religions, within the Latino community, within the Asian American community. So there are a huge number of cultural identities that come along within the LGBT community. So people may have other cultural identities that are more important to them when it comes about decisions they're making about their healthcare than being LGBTQ. To the extent, I don't know of any specific vaccine-related issues that are specific to LGBTQ people, but the one thing I would say, and Dr. Pierce kind of set this up really well, is that a lot of it comes down to trust in their provider and trust in the healthcare system in general and having a good relationship. Because unfortunately, the medical community has, in the not too distant history, contributed to the stigmatizing and marginalizing and pathologizing of LGBTQ people, and people who have either had experiences with that or who fear having experiences with that can be hesitant to come to us for care. So, and when we're talking about children and the vaccinations for children, we're really talking about families. And this image is sort of the classic image of family that's been promoted in our popular culture for a very long time, up until very recently. But families don't just look like that, and we all know that. Even within families who don't consider themselves LGBTQ, families don't necessarily look like that. And so I think a lot of this is about being welcoming to all kinds of families and making sure that our practice is a place where people feel safe and welcome. So the sorts of things, and so some of this has already been touched on, is that you want to think about are what sorts of imagery is being used to represent families in your practice. Pictures on the walls, the materials that get handed out, the things that are sitting in the waiting room that people are seeing. The forms were kind of touched on as well. Does the form say mom, dad, or does the form leave a little room for people to explain who they are and how they're related to the child? Are there gender neutral or family restrooms available for people to use? At the very least, is there a place to change a baby for somebody who's not using a woman's restroom? Those sorts of things, just to make your practice a welcoming place, which as individual providers, depending on where you practice, may not be something you have control over directly, but advocating for that. And when those things aren't really available, for example, the form, acknowledging that when the patient comes in and saying, I'm sorry, our forms are kind of out of date, but let's, cross some things off and let's talk about how you're related, who's all here and how you're related to the patient. And also we talked a little bit about staff being trained and sensitive to that population as well. When you're in the exam room, the biggest thing is using people's preferred names and pronouns, and if you don't know, to ask, because some people will go by he or she, but some people will use they or other pronouns entirely, and what they go by may not match up with what their presentation is, what you're seeing, or what your interpretation of their presentation is. So it's always a good idea, if you're uncertain, to ask. And if you get corrected, to just apologize and try to remember for the future. also to acknowledge social parents. And again, this isn't just with the LGBTQ community, so I know a lot of people are already familiar with this idea, but we know that it's more than your biology that makes you a parent. And LGBTQ families have, in not too distant past, been asked questions like, who is the real mother? And so we should be really clear about the parents are the parents. And when we're talking about biology, when we need to talk about biology to assess risk, when we're talking about breastfeeding, those sorts of things, to be clear that that's what we're asking, but to just acknowledge that all parents in the room are the real parent. Just briefly, I touched on this already, but gender pronouns, because there are quite a few. There's people who go by he or she, and people who go by they, them, and people who go by other pronouns. C is one of the ones that was kind of initially people started using, but there are other pronouns as well. Then when we get into sort of adolescents and adults, for children, vaccine recommendations are pretty much the same across the board, and so not much changes based on the fact that the parent may be LGBT or the child may be expressing gender differently. But when you get into adults and adolescents, you do start to have some slight differences in the recommendations. So the HPV vaccine we're now recommending for women through age 26, men through age 21, but men who have sex with men is recommended through the age of 26. Now by the age of 21, when the recommendation would change for people, usually people aren't coming to the doctor with their mother anymore or their father, but it may be that people will be there with another person, and that by telling them about this recommendation, you may be inadvertently outing them to whoever they're with. So being sensitive to that and aware of who's with them and if they're out to that person and what's okay to discuss in front of them and what's not. As far as vaccination rates for HPV, the vaccination rates are lower among men in general right now. The study I was able to find said about 8% receive more than one dose, as compared to 56% of women nationwide, and that's all men and women. So we need to do a better job of promoting vaccination for men in general. Also, women in rural areas who identified as lesbians were less likely to be offered the HPV vaccine. So again, I don't think most people in this room practice in a rural area, but maybe some people watching do. Something to be aware of is to be offering this to all of our patients. And then also there have been some studies that have shown that men who have sex with men have been overall open to receiving the HPV vaccine as part of their routine health care, if it's offered that way. Meningococcal vaccine is again being promoted for men who have sex with men in Chicago right now because of some meningitis outbreaks that we've had. And again, being sensitive to the fact that if you're offering that vaccine to somebody and they have someone else present with them in the room, that you may be outing them to that person if that person does not already know. Hepatitis A and B, again, most children will have had this vaccine as part of their routine childhood vaccinations, but for adults who have not had it, it is recommended for men who have sex with men and others who engage in certain sexual practices that would put them at risk. And I believe that's about all I had. If anyone has any questions?
One question. So how do you address vaccines in a respectful manner without making the patient feel that they need to reveal their sexual practices?
Mm-hmm. So hopefully, you know, I think it's a good thing to try to take a sexual history that's thorough if you're able to. But if you sense that the person is uncomfortable talking about it or doesn't want to share their specific practices, I would probably err on the side of trying to normalize as much as possible, recommending vaccinations that you think they may need, and saying, you know, even looking forward, you don't know what you may decide to do in the future, that this would be something that would protect you in however you end up deciding to express your sexual feelings towards other people.
Okay, so maybe wait about a minute or so to see if any other questions come up. from our webinar audience?
And as a way to that, first and foremost, thank you all, thank you to our partnering organizations that were able to bring us together today. When we look at from a policy perspective, and if I could just ask each of you, because you touched on different patient populations, coming off of a very long-standing experience without a state budget, looking at CHIP and the federal budget that's being, discussed now in D.C. So from your lens, and if you had a blank canvas, what are some specific policy and legislative aspects that we should be focusing on from a state perspective, specifically here in Illinois? I'll start. I would want to make sure that all primary care physicians are aware of the value of reauthorizing CHIP for children. And I would want to make sure that now that Illinois is shifting to have Medicaid HMOs, that those HMOs are still providing the same benefits, if you will, of the state's previously run Medicaid. There were some very large differences in formulary coverage for children. There were restrictions on quantities of prescriptions that could be filled at one time, which could be very harmful if you have a child with, chronic medical issues like allergies and asthma, and they may need more than 4 prescriptions at one time. So I want to make sure that we're strengthening vaccines and really making sure that we're having prescription drug coverage.
I agree with Dr. Pierce. I think the state will hopefully, if I had a magic 8-ball and could wish on it, I would say that we could put more money definitely into the underserved populations. I think that we're all representing, and that they not only cover more prescriptions, they cover vaccinations, and that they allow wonderful primary care physicians like I'm sitting here with today as part of their network, and specialists as well too, because I love actually being able to give back to the community and serve on Medicaid and so forth, but sometimes they make it very hard for specialists to be on Medicaid plans. So if I had one wish, I'm willing to see as much Medicaid as they will let me, because I love to give back to the community. So that would be one thing I would definitely want to do.
For me, I would say at our clinic, this whole CHIP, non-CHIP insurance coverage of vaccines, it's been a big deal. Kids should be able to get their shots. And the insurance shouldn't determine if they're getting mandatory versus recommended. And we've seen a big drop in the HPV rates. We've seen a big drop in all of the insurance, all of the immunizations that are not mandatory. But they're recommended, and kids benefit off of it. And, we will decrease our herd immunity going forward. So I don't know who's making these decisions at these state levels, and why vaccines would be a place where they would want to make the cuts. And so that's what I would very, very strongly advocate for. Despite everything that we've said, I think, as primary care physicians, we're all very invested in getting these kids and their parents to a phase in which they're getting the immunizations. And then the state is not helping us by, then not giving us the vaccines. As a federally qualified health center, our board has been very, very supportive in paying for these vaccines and having them be there, despite all of this uncertainty of whether we're going to be reimbursed for them or not. And I've seen, in our area, a lot of the doctors in private practice not giving the kids the recommended vaccines, sending them over to us, and it's hard as an FQHC to kind of hold up all of these kids and give them all of the shots. So, instead of making our work harder, they should try to help us out by having the vaccines available for if and when these families decide that they want to get the shot. Because you may have missed that chance with that family. They want to get the shot, but now you don't have it. Mm-hmm. So who knows if they're ever going to come back to getting it. And then everything they said about formularies and limiting medications, and also the specialty access. And we're lucky. I still tell my patients, we have Luries, and they'll take you, irrespective of anything. But to have 4 and 6 month wait times to see specialists, it's really disappointing in America in 2017 that we're having all of the problems that I had growing up in India and training as a medical student there. I find it fascinating that I revisiting this 20 years down the road in like the most advanced country in the world. So to me, that it's really disappointing that our state and our country would want to focus on the health of its children.
Yeah, I agree with all of what has been said, and I would also say from just my perspective today, for LGBTQ families, it's really important that we not go backwards and that we focus on policies that protect LGBTQ families, because, and I had hoped this was a settled issue, but it appears it's not. When businesses are able to discriminate against families, we're able to say we're not going to provide, for example, benefits to the partners of LGBTQ people. That creates a huge healthcare problem for those families, for insurance coverage, for access to care for them, for their children. So I think it's really important. And of course, we all know that the health of children is really critical for the health of the whole family. Those are two things that go together, and you can't separate the family's well-being from the child's well-being. So that would be something I would say we need to advocate for.
Thank you.
Okay, so thank you guys again for being here, and thank you for everyone that's in the room and then also online. We really appreciate it. We hope that you take this knowledge and really implement it and think about it and bring it back to your workplace, just to make sure that we are serving the communities that we see. And so I guess we will end it there.
Thank you.